Assalamu alaikum. My name is Dr. Anwar Shahzad. Today we will discuss a very important topic that is dengue fever. So this fever is very common these days, and we have to play our role in the prevention of this disease and to create the awareness among the people. So it is. I will stress on the saying that prevention is better than cure. That is, before treating, spreading the disease, we should try as a whole to prevent that disease. So in case of dengue fever, this disease is spread from one person to another by a mosquito, which bites a diseased person and then bites another healthy person and transfers the disease into that person. So if we break this network, that is, the mosquito should may not be able to bite again the diseased person, or it may not be able to bite a healthy person, or we can kill them. We may be able to kill the mosquitoes, and we can prevent their spread. That is, we should avoid the this water stores outside where these mosquitoes grow. So these things, which are very little and not expensive, don't need any money, but needs awareness and the wisdom. So it is our duty as a community workers and as a Pakistani that we should play our role at our level to prevent this disease. That is the spread of the disease by killing the mosquitoes, by this war, wearing full suite, this full sleeve dresses, and using mosquito repellent solutions, and other measures which can be done are instructed by the government or the authorities. So this dengue fever is a fever, of course, and it may reach up to 40 degrees centigrade. And after a bite from by a infected this mosquito to a person who was previously healthy, he will create these established symptoms after 2 to 5 days, and he will develop fever. So when the person comes to the doctor, he uh, will look after or create this, take the history and try to establish the diagnosis whether this is a fever of what type. Is it a dengue? Because this dengue is common. So we will suspect, and we will have the symptoms and even the help of the lab. So the this virus, its protein becomes positive and remains positive in for 7 days or 5 days, and this can be detected by NS1 test. And but after 5 to 7 days, this the virus this disappears and antibodies are produced. And if we want to diagnose or this detect the disease, we will detect the antibodies, which may be IgM, electron IgG antibodies. So by the ELISA. So this, and we perform the CBC where the platelet may be below 1 lakh and TLC below 4,000. So these by combining these tests and the clinical symptoms of the patient, we can suspect or even the diagnose the patient if it is the sufferer from the dengue fever. Although the government's instructions are that is, if you suspect the probable this dengue fever, then you should refer it to the higher centers. And the symptoms of the treatment is that the patient is suffering from the high grade fever. Of course, we will give him paracetamol and course findings and the symptomatic treatment. And if the fluid is needed, and fluid will be given. But the thing is that if the patient suffers from the dengue fever for the first time, that recovers in a week or so. But if he is infected second time by another strain, usually he will develop more critical symptoms. So these symptoms they are maybe serious, and it is they are a categorization, that is the patient who is without warning signs, another with warning signs, another with hemorrhagic symptoms, and fourth is the with hemorrhagic shock syndrome. So although all patients they do not this suffer or pass through all these stages, but they are gradually, and there are certain patients who are usually reinfected. They can suffer from this. Few of them will suffer from the disease, and this disease will be maybe fatal because there is no specific treatment. So we have to do the specific treatment and the general measures. That is, if there is blood loss, you can give the blood. If fluid loss, we can give crystalloids and chlorides. We will not give hypotonic solution. There is the permeability of the capillaries is increased, and fluid goes into the interstitial space, causes edema, pleural effusion, and ascites. And if there is hemorrhage only, then the hematocrit will be low, and we will have to transfer the blood uh, to that patient. But all these things, which are only the first without warning sign, and is treated as a OPD basis. And if the patient is more than having more critical symptoms, and the third and the fourth stages of the disease, we will refer the patient to the higher centers. So he may be diagnosed, confirmed, diagnosed, and may be treated accordingly. And that is all today. Thank you very much. Assalamu alaikum.